everyone. It is Tuesday Tips, and the title of our Tuesday Tips today is Leaving a Nursing Home. What is against medical advice or AMA, and what are some of the possible consequences? So, hi, everyone. Welcome to Tuesday Tips Live with your Nurse Advocate Consulting. I'm Pam, and today we're talking about a situation that's emotional, confusing, and honestly a little scary for many families. What happens when you or a loved one wants to leave a nursing home against medical advice or AMA? On basically, what that means is the medical community is saying you're not ready to go, but you or your loved one want to leave. So I'll be sharing not just the facts, but I'm going to share my own personal story with my mom. So if you're facing this decision or just want to be prepared, you're in the right place. If you're joining live, drop a hello in the chat and let us know where you're watching from. And as always, thanks to all of you that are catching the replay here or on our YouTube channel. So let's go ahead and jump in. Have you ever felt torn between what your heart says and what the medical team recommends? Maybe you or your loved one wanted to go home, but the doctors and the staff said, really advised against it, that they weren't ready. That's exactly what happened to my mom, and it's something that many families face. So let's talk about what AMA really means and what you need to do before making that call. Again, AMA, we're going to talk about that, but that means against medical advice. And it's a formal term used when a patient or their decision maker chooses to leave a healthcare facility like a nursing home or a hospital, and even though the medical team recommends staying. This isn't about being difficult. It's about weighing personal wishes, comfort, and sometimes even financial or emotional realities against medical recommendations. So I also want to say that it is a legal process. There's paperwork involved, and it can impact what happens next, both medically and with insurance. So what I'm going to do is I'm going to go ahead and I'm going to share a little bit about my mom's story. So within the last couple of months, my mom was in a nursing home following a hospital stay. She wanted to go home, and to be honest, we were in a one-star facility. If you're not sure what that is or how to rate them, drop a comment in here and I will get you that information. That's like a story for another day, but there are ways to check and see how Medicare rates nursing home facilities. And so, to be honest, again, we were in a one-star facility and we knew the care wasn't going to be as good as a five-star facility. We tried to get her into a five-star nursing home that was covered by your insurance, but they were full, and this ended up being our only choice. And, of course, the five-star facilities are going to fill up faster because everybody wants to go there. And, as her daughter and also a nurse, I understood both my mom's wishes and the medical team's concerns. She was weak. She was newly dependent on oxygen. She was in the hospital for 9 days before going to rehab. And she, was nowhere near ready to go home alone, where she was independent and home living on her own before going to the hospital. So I knew that she was not ready to go back living independently. So, after 9 days and many issues, we had one instance that was really kind of the straw that broke the camel's back. And we decided we were taking her home. This is where even, my sister's a nurse practitioner, and even those in the medical community, if you don't have experience in dealing with AMA, the paperwork, the consequences, you may not know that. So this is a great opportunity to consult a nurse advocate like ourselves that have experience with this and in the senior space, because what happens is in the hospital, if you leave against medical advice, there are medical consequences for sure. You could end up right back if you go home too soon. You may not be able to get a doctor appointment soon enough after you leave the hospital to really make sure that you're on the mend and you are recovering. But with a nursing home, the financial reality is extremely real. And what I mean by that is a lot of insurance companies, Medicare Advantage plans, they may not pay for the entire nursing home stay if you leave against medical advice. You're going to have to sign a release form. You're going to have to sign paperwork that says that you understand that you are leaving when the medical team is recommending that you stay. And so that, that not only are there care um, issues, medical care issues that can arise from leaving against medical advice, but you could also end up with a big bill from that the insurance company did not pay for your nursing home stay. So that is a big reality. And this, we knew that this was a possibility. And so my thought process was, before we asked the nursing home, and this was a Saturday morning, we didn't expect that there would be administration there. So I knew from the get-go that this was not going to be an easy task to get my mom out on a Saturday and not have her deemed that she left against medical advice. And so what we did was, we contacted the administrator, or we contacted the nurse on the floor. She said that there was a nurse administrator that was on call. We talked to her. We shared our concerns. We shared the incident that morning that was kind of the straw that broke the camel's back, and said that we don't want her to leave against medical advice. She could get the same, if we could get the same care for her at home, would you consider discharging her, having a doctor, provider giving a discharge order saying it was okay to go home, and so that she wouldn't have to leave against medical advice. And so what we had to do to put in place, I arranged, we had home care already coming on Monday. She was going to be staying with my sister. She was not going home alone. So we were getting her nursing at home, physical therapy, occupational therapy. They were willing to provide an aide to assist with bathing while she was, at my sister's home. And with my sister being a nurse practitioner, with me being a nurse, we felt that there wasn't anything. We had her concentrator at home already because she was on BiPAP at night. So she used oxygen at night when she slept, but she was not on continuous oxygen. So we were able to meet her oxygen needs. We didn't have to get any equipment from another company to bring her home. So we really, really stacked the cards in her favor of not giving them a reason to warrant that she would leave against medical advice. So once we convinced the administrator to please contact a provider and ask if they would consider writing a discharge order for her. We did get a hold of the nurse practitioner that was on call, explain the situation. We'd already met her a couple of times, so I think she knew that we had things under control, and she did agree to write the discharge order. And you know what? She was the most amazing part of that whole nursing home stay. She wrote the orders. She wrote the face-to-face, which is a paperwork requirement where you have to see a provider within 30 days of starting home health care. She wrote that. She wrote all the orders for her medications, her pain pills. She wrote everything that she needed for us to be able to take her home. So by early that afternoon, we actually had her home. But, it was a lot of tough conversations. The staff explained the risks, and that's their job. They need to explain the consequences of you leaving against medical advice. They talked about her mobility. They talked about her weakness, her medications, and what can happen if she left too soon. But, we were clear. We wanted her out, and we were going to do what we needed to do to follow the rules. But again, to tick all the boxes, check all the check boxes, and make sure that we did not give them a reason to have my mom leave against medical advice. So we ultimately decided to sign her out. But again, it was a discharge, so it wasn't against medical advice. So we weren't concerned that the insurance company was not going to cover that. And we did worry about her safety, but I also knew her well enough to respect her wishes. And I knew my sister that she was going to stay with, even though she was the non-medical sister of the three sisters. And then we also have two brothers. She's a quick learner. She's very committed to our mom, and I knew it was going to be okay. And she works from home, so that was even better. She was going to be able to get her to doctor's appointments and things like that. And I actually am a long distance, the only sibling that's long distance. So I manage a lot of things over the phone and make all those kind of arrangements. I'm about 4 hours from home. It was really stressful, but, it taught me so much about the importance of advocacy and what I do for clients, planning and listening to the person and making sure that they are the center of the decision. And not only that, but making sure that if I have a client in the future that wants to leave a nursing home, that we have everything in order before we do that, and so that we cannot run into that risk of leaving against medical advice. So what are some of the possible consequences? We kind of shared some through the story with my mom, but if you or your loved one leaves AMA, we talked about the medical risks. One of the things that the insurances are really picky, and they really come down hard on the financial piece, kind of hitting us in the pocketbook when you leave against medical advice with a nursing home, is because what they found is that leaving the nursing home too soon often results in readmission to the hospital in less than 30 days. Now, a lot of hospitals are penalized by Medicare, plans that if they are readmitted to the hospital within 30 days of their discharge, that's a bad mark on that facility, saying that they didn't have planning, they didn't get the treatment or the care that they needed. So that's one of the reasons why the insurance companies are pretty hard on people leaving early out of the nursing home, because they do see those readmissions, and it costs them a lot more to pay for you to go back to the hospital than it was when they were paying for your stay at a rehab or nursing home. Those are the medical risks. Safety, falls. A lot of people go home and fall within a day or so when they're leaving early because they're just not ready to go, and they don't have the equipment, and people at home don't have the training that they need to help prevent them from falling and doing the things they need to do to provide the medical care. We talked about the insurance issues. It's not always black and white, but it is a real possibility. Not so much when you leave the hospital, but definitely a lot bigger of a concern when you're leaving the nursing home. There's care coordination. So if you leave against medical advice, you may lose, certain aspects, certain services or support that the facility provides, like that coordination with ordering equipment, ordering this, setting up your next doctor follow-up appointment. So discharge planning might be rushed or incomplete. And last, there's the emotional impact. Families can feel guilty. There's a lot of anxiety. They could feel conflicted, especially if something goes wrong after discharge. That's why it's really so important to have a clear plan and a support system in place if you decide to go this route. So just want to kind of finish up with some tips for families facing this decision. And have a candid conversation. Talk openly with the care team. Ask about the specific risks and what you can do to minimize those risks, when taking your aging loved one home. Get instructions in writing. Make sure you have clear instructions for medications, follow-up appointments, and warning signs to watch for. And so we did, we got her discharge summary. It had her new medications on it. It had all that follow-up information on. So that was complete when we took her home. So arrange for support. There may be home care equipment. You may need a wheelchair. You may need a walker. You may need a gait belt. Make sure that you have all the things that you need before you go home. And know your rights. You always have the right to make decisions about your care. No one can make you go to a nursing home. No one can make you stay at a nursing home. So you do have rights. But it's best to make those decisions with as much information as possible. And lastly, don't go it alone. This is what we're here for. Reach out for help, whether it's a nurse advocate, a social worker, another professional. Make sure that you have a guide, that can help make all the difference in the world. So have you or someone ever faced this? Drop your story or questions, in the chat or comments, and let's really support each other. If you've experienced any more tips, resources, or you need help navigating a tough healthcare decision, please check out our website. We've got a whole tab for free resources. Don't forget to subscribe to our YouTube channel for more replays and tips. We've got interviews, and we've got all kinds of videos there. You just need to search by topic, and maybe, think about sharing this video with someone that you think might need it. And if you're in the middle of a crisis and you need personalized support, just know that your Nurse Advocate Consulting is here for you. So thanks for joining us for this Tuesday Tips Live. Remember, you're not alone in this journey. We'll see you next week. And until then, take care of yourself and your loved ones. We'll see you soon. Take care now. Bye-bye.